Hi, Charlie.
Hi,
Thanks for joining us today to talk about the risks of alcohol use in older adults.
thank you for asking me because I feel strongly that more people, really all people, should be better educated about alcohol and drug use among older adults. I
Mhm.
mean, for one thing, most of the drug use problem with older adults is unintentional. If, for example, somebody who's been drinking, I don't know, 3 drinks on occasion, sometimes when they are socializing when they're younger and they handle that okay.
Mhm.
Somebody 70 years old, because they're much more sensitive to the effects of alcohol, that's like drinking 6 drinks instead of 3.
Well,
And most people, I don't think, know that. I mean, they may experience to some degree. That
mhm.
is, they'll notice, gee, I only need a drink to start to feel a little intoxicated. When I was younger, I had to have 3 drinks before I start to feel intoxicated. They may, but a lot of people don't notice it.
Mhm.
And so they're drinking more than the safe level. And why is that important? That's important because the number one effect, the most major effect of drinking too much for older adults is health effect. It injures their health. If they have health conditions already like diabetes or hypertension or coronary artery disease, there's many others. Drinking too much really makes all of those conditions worse.
Mhm.
And so if you want to manage your health problems better, it's better, frankly, not to drink at all. But then if you do drink, at least drink at a safe level.
Right. And what is happening in the body as people age and are, get into their mid 60s by that point? What's going on?
Basically, they cannot process alcohol as effectively as they did when they were younger. Their liver can't deal with it as well, the kidney, also the brain. The because of with age, we have some cognitive decline,
Mhm.
which is natural. We used to have, some cognitive decline, like some memory problems.
Mhm.
Drinking is going to make those worse. And the more the person drinks, the worse it's going to make those conditions.
Right. And medications are also an issue.
Absolutely. Particularly, there's some medications that interact very badly with alcohol, badly in the sense it creates more health risk.
Mhm.
And some of those medications are opioids, prescribed pain medication,
Mhm.
or sleeping pills, which is the major group of sleeping pills are the benzodiazepines,
Mhm.
and also for anxiety. Those medications in particular, what they do is potentiate the effects of each other. And so when you're taking, say, a sleeping pill and you've been drinking that evening, and you take a sleeping pill on top of it, you're going to be more impaired. So
Right.
then, if you have to get up to go to the bathroom, you may fall.
Mhm.
We know that this is actually the reason why some people, particularly older people, fall
Mhm.
because actually they're impaired. They don't know they're impaired, but they are.
Right. Right. And can people talk to their doctors about these risks with their various medications they're on?
Very much they should talk to their doctors because, as you heard me say a moment ago, the number one effect that's a problem with drinking alcohol in older adults is health problems. And so, since it's a health problem, it's a natural problem to have a discussion with your doctor to, for example, if you keep being prescribed a new medication, to ask the doctor, well, how will this mix with alcohol? If I ever drink at night, will that have any effect on this medication? Will the medication have any effect on me?
Mhm.
And that's also true with medications. I mean, there's some medications that interact badly. I mean, badly in the sense of health effects. For example, opioids and sleeping pills. That's one of the worst combinations. Prescribed pain medication, prescribed sleeping medication. When people take both of those medications, they're 5 times more likely to have a medical emergency because they're taking those medications and how they interact with each other.
People should really watch out for those ones.
Yes, those in particular, those result in more ED visits than you would probably guess. I mean, some estimates are medication interactions for older adults is 20% of their ED visits. I mean,
Right.
as a population.
Mhm.
So it's really pretty high, uh, in a number that are affected by medication interactions. And those can be avoided by being more educated
Mhm.
about your medication and the effects of alcohol and and wanting to be healthy. You know, if you want to be healthy, then if you drink, you should not drink much. For older adults, more than one standard sized drink a day is risky.
Mhm. And I wanted to point out too that pharmacists are a good resource for asking about medication interactions.
Absolutely. They probably know more about medication interactions than any other professional. Yeah, physicians know what medications, what treatment they do.
Mhm.
Pharmacists are more concerned about medication interactions,
Right.
and so they know a little more about that. And they also know about interactions with alcohol. So asking your pharmacist when you particularly pick up a new prescription is a good idea. I take these other medications. Is this going to be okay to take this with this? Or I usually have a drink at night. Is this medication okay for me to take and be safe and continue to have my drink?
Right. Pharmacists can be very helpful and they're available and you can call them if you can just call them with a question if you need to. So that's
Yes.
a resource.
Well, they're the experts on medications,
Mhm.
and medications are basically pretty complicated. I think we all know that. I mean, there's a whole lot of chemistry, and
Mhm.
it's a pretty advanced science, frankly.
Right. Now, what can people do to cut back, and what can family members or, in some cases, caregivers do to help encourage someone kindly to cut back on drinking if they're concerned?
To frame it as a health concern, you want to have healthy aging,
Mhm.
then you should not drink more than the safe level.
Mhm.
I would say talk about it in terms of the health effects, not in terms of the drinking itself being bad or something. That's not the issue here. The issue is that for older adults, it can affect them with their health is affected. And if they have certain medical conditions, their health can be a lot affected, particularly, again, in a negative or unhealthy way.
Mhm. And caregivers and other people in the person's life can educate themselves and share that information if they're concerned.
Right. And it's best to keep the focus on the health,
Yeah.
because that's the point. It's not that drinking is bad because you're drinking. It's drinking may be causing you more problems health wise than you realize.
Right, right. And we're going to share contact information for Vermont Help Link, and they're just very helpful and free to call and can offer information and guidance on how to have these conversations that aren't always the easiest conversations to have, and also just some of the things that can happen with drinking or in families and friends on this topic of alcohol. So they're a really great resource.
Yes, they are. It's a one number to call across the whole state, and you can receive good information, and you can actually get connected to help if that's what you're calling for.
Great. That's great. You've shared a lot of really helpful information in a short amount of time. Is there anything before we end the conversation that you'd like people to be sure to know about this topic?
Mostly to be aware that it does have or can have a significant effect on your health. It's going to have some effect, if you drink a little,
Mhm.
but it's going to have a negative effect. And so you kind of have to weigh how much you enjoy having a drink versus, concerns about your health.
Yeah,
And to me, that comes down to definitely don't drink too much, which
right,
for older adults is more than one drink a day.
right. Important to remember. Well, thank you very much, Charlie. We appreciate your expertise.
Thank you for inviting me. I'm always glad to both spread the word about this, because I'm in that age group. So, I, this is important to me too, what we're talking about.
We appreciate it. Thanks.
Thank you.